So the levels of observation keep raising their head in a lot of cases that I get involved with, and also within the training. And levels of observations are used throughout the secure custody sectors. So you'll find even in clinical sectors in the prisons there's what's known as levels of observation. But for the police there's 4 levels, level 1 to 4, and I want to particularly look at level 2 in this video. Now, level 2 is the minimum acceptable level of observation for a person who is influenced by a level of intoxication. So that will cover alcohol and or drugs. And the reason for this is because if a person is influenced and intoxicated to some level, it increases the risk of death in custody. So level 1 is for your mainstream person for whom there are no suspected risks of any nature. But level 2 is the minimum acceptable level for a person who has a level of intoxication, so they're under the influence. Now this means that they must be visited within 30 minutes. Now that doesn't mean to say you go at every 30 minutes, it's within 30 minutes. Now also within those 30 minutes at every visit they need to be roused. So rousing does not mean just looking through the spy hole or dropping the hatch and listening to see if you can hear breathing. Rousing is then covered by Annex H in the Police and Criminal Evidence Act Code of Practice C, Annex H, and it lists in there what you're supposed to do every half hour. So the first is about looking at the rousability of the person. Do they actually rouse? Now in first aid training you should then learn in relation to rousability as part of the Dr. ABC process. And rousability means, are they alert? So can they respond to voice? Is there a level of alertness? So you need to confirm that there's rousability. You also need to be able to confirm that they can respond to questions and commands, so that we've got neurological function and physical function that's working. So it's no good just saying "oi" and then going a grunt back. That is not a rousing procedure as per PACE. So things like question wise, tell me what your name is, where are you now, where were you last night, and then they need to be able to put more than one word together to show that there's a neurological function. And then a command aspect is, can they actually get up, can they move? If the person's been laying on the cell floor for the last 2 hours but every check that's gone on they've grunted, they're not meeting the rousability in relation to commands and response. You've not demonstrated that they can actually physically move and do something. So there needs to be some element of command there, getting them to do something. Can you lift an arm? Can you stand up? Can you move? Or you can see them actually moving. A person who is just laid there, lifeless, but grunts, they do not pass the rousing test. And then remember. So remember means the specific conditions that you must consider at every time you do that visit. And those specific conditions include head injury, because head injury can be masked by signs of intoxication, diabetes, epilepsy, any form of overdose of either alcohol and or drugs. And that drugs doesn't just mean illegal drugs, it could be prescription drugs, or stroke. So head injury, diabetes, epilepsy, overdose, stroke, those are specified conditions that you should be remembering every 30 minutes within that every 30-minute visit. Now, the College of Policing Authorised Professional Practice uses the phrase about positively communicated with. So when you're visiting the person, you must be able to demonstrate that you're positively communicating with that person. And again, it comes back to the whole purpose of what is the purpose of visits and rousings. It's not just looking through the spy hole and seeing that they're there or that they're breathing, because again, breathing often gets misunderstood. Breathing means either breathing normal or not normal, not just is there a sound of breathing or is there no breathing. And a separate YouTube video will cover the issues about normal and not normal. And again, that's a common factor which appears in some of my deaths in custody cases where the person, they go on the visits, they've dropped the hatch, they hear the person snoring or heavy breathing, and so they think they're breathing and that they're okay, but really the noise that they were making was actually like what can be known as agonal breathing. This person was actually in medical emergency crisis, but it might not have been picked up on. So level 2 observations: any person under the influence of drink or drugs as a minimum must be on level 2 observations, which means within every 30 minutes they must be visited and roused, and that roused must be as per PACE, Code of Practice C, Annex H, which means you need to demonstrate rousability, response for both questions and commands, and you must demonstrate that you've remembered specified conditions of head injury, diabetes, epilepsy, overdose and stroke. And if there's any questions, don't hesitate to get in touch or look at some of our other YouTube videos. Subscribe to the channel because more topics will be posted over the coming weeks and months. Thank you.